So, regarding public health and water quality, there are two terms are here. One is public health means health of the public. That aspect is coming under the public health. It's a very wide area. Different, for example, if there is some kind of corona infection, who are mainly concerned is the public health department, municipality, corporation, panchayat, all will be involved. So maintaining the public health is not a responsibility of few doctors or nurses. It is a responsibility of several people in the government. And similarly, another aspect is the water quality. There are different aspects are there in ensuring the quality of the water. So that we will be discussing. So public health has been defined as a science and art of preventing disease. So problem with so for example, few students in your class are having some kind of viral fever. What will be the impact? After some time, entire class will be having viral fever. Then entire college will be affected, and those students who are coming from certain areas and people in that neighborhood will be affected. So in order to prevent the disease in a wider area, we may need to isolate people. That was what we are seeing in case of corona. So it is an art and science of preventing disease. That job or that responsibility is usually conducted by municipality, corporation, health department staff, rather than directly by doctors or nurses. So public health is a science of protecting and improving the health of the people and their community. So nowadays there is a science known as Master of Public Health. In India it is very rare, that course is not much popular, but if you go abroad in most of the Western countries, you can see Master of Public Health. It's a very important branch. It's highly lot of job or it's a very high career opportunities are there in most of the developed countries. But in India, not that much level of opportunity are there, but still very few universities are offering Master of Public Health. So there is some demand. So mainly in those kind of subjects, mainly how we can prevent and protect the widespread occurrence of a disease. That will be the main aspect in public health. So so if you go to such sciences like Master of Public Health, it's not purely science alone. There will be some scientific aspect, some biological aspect. There will be some economics, some geography. There will be some math related data science will be there. So all these will be coming under the Master of Public Health. So this work is achieved by promoting healthy lifestyle, researching disease and injury prevention, detecting, preventing, responding to info. So it's a very wide area. You will break it down. The first sentence is this work of preventing disease in a society is achieved by promoting healthy lifestyle. What is healthy lifestyle? Nowadays, for example, a lot of people are having diabetes. A lot of people are having cholesterol related problem. A lot of people are having heart related problem. So if you look at the underlying reasons, most of the time this may be a result of either alcoholism or overeating or due to lack of exercise. So all these will be creating problems like diabetes, cholesterol, hypertension. Then there are a lot of other problems like cancer, for example, smoking, use of drugs. All then can result in the development of different type of cancer. So this is how. So in order to prevent disease, we have to create an awareness in the public that a healthy lifestyle, a healthy way of living is very important. So that is one aspect. Second aspect is researching about disease. For example, now what happens in the case of corona? When coronavirus was detected, after a period of few months, the scientists were able to bring out a new vaccine against that. So when we are exposed to a new kind of disease, only if there is an active research data, we will be able to produce either a new vaccine or a new medicine or a new method of preventing that. So research on New diseases or rare diseases are always important. That also coming also, that aspect will be done by scientists, biological scientists. Then detecting, preventing, responding to infectious disease. Detection, prevention and response. For example, you know case of corona. So there are all, you know how the COVID or corona will be expressed. It is just like a normal fever. But unless we diagnose it or detect it using a blood test that this person has corona, we are not going to take extra care. Now we are not that much bothered about corona because we are all exposed. We know how much problem it will create. But earlier it was not the case. So when a new disease or new virus is coming, there should be some mechanism, some test should be available to confirm that this is a new kind of virus. For that, there should be a lot of laboratories should be there, laboratory technicians should be there, then medical laboratory people should be there. Otherwise, what will happen if there is a shortage of laboratories, shortage of medical laboratory people, then a lot of people are infected and everybody is going to lab for taking tests, and there are not sufficient number of medical labs. And what will happen? Most of the people may not be may not be diagnosed properly. That problem will be. So when we speak about public health, it is not just the responsibility of few medical people alone. A lot of other kinds of people are also actively involved. Overall, public health is concerned with the protecting health of the entire population. Here, this is an important term. Entire population means poor, middle class, and rich. Normally, if there is some kind of disease, rich will always escape because they have money. They will try to influence government. They will try to influence medical staff, and they will get the best treatment. But what will be the case of poor people? They don't have money. So if poor people are having this disease, the virus doesn't bother between poor, middle class or rich. If all the poor people in your neighborhood are having some kind of a disease or some kind of viral disease, you are always vulnerable. Anytime you can be infected. So this is the another important, protecting the health of entire people, whether they are rich, poor or middle class. So that job is actually a responsibility of the government people. So only government can do that. So government can ensure that all the people of the community, all the people of the society, irrespective of their financial position or financial status, are able to get some kind of treatment, some kind of medicine, some kind of precaution they are able. So that aspect is, so if you want to protect the health of the people, we have to take care of all the type of people, rich, middle class or poor. We should not make any difference. So that is also an important aspect of public health. This population can be as small as a local neighborhood or as big as an entire country or region of the world. So this is an important aspect. So when in public health, we have, for example, a new disease is spreading. That is spreading in Kottayam area. And government should have enough data to know that where the people of the Kottayam area are mainly concentrated. What are their financial status? What are their education level? All this information are important in preventing disease. People who are better educated will take more precaution. So when that kind of aspects are coming, it is pure mathematics. It's pure data science. Nowadays, a lot of new type of sciences are coming, like GIS, Geographic Information and System. GIS, only data location-based data are very much important. In what particular area of Kottayam district the disease is mostly concentrated? How many hospitals are there? How many doctors are available there? That aspect is actually coming under GIS people. So different type of people are coming. Lot of work of data science will be there. Logistics people will be involved. Logistics, we have to transport medicines. So for that, logistical people will be involved. So when we say about public health, it is not just doctors or nurses. Lot of people in the society working in different area are involved. So that is why public health is a very wide area involving people from several disciplines, not just biology, from engineering, economics, mathematics, politicians, all kinds of people will be involved in protecting the public health. So public health professionals try to prevent problems from happening or occurring through implementation of educational. What they are doing, one problem one way they are doing it is by conducting educational programs. For example, sometimes when you go to hospital, they will be writing, give your baby breast milk. That is one kind of education. Then in most of the hospital, baby friendly hospital, then they will also advise you to take all the vaccination for your baby. So these are all part of education. Then sometimes during rainy season, government may bring out ads in the TV or in social media asking you to boil the water and drink it. It's a simple thing, but it's an education. So these kind of educational programs are also done recommending policies. Policies means our political people, our civil service people are actually deciding what kind of things should be done in our society or in our state. And for that, politicians should be aware of that. Politicians should be well educated. They should be properly advised what kind of actions are suitable in such a situation. So this is all the job of public health staff. They are undertaking research, they are making detailed study, and they give proper guidance. So that is why in Western countries, if you go to most of the Western countries, health system is not as developed or as widespread in most of the developed countries. They have very good techniques, but the spread what we can accessibility of health professional. For example, if you want to see a cardiologist in Kerala, you can go to any hospital and see the cardiologist that day itself. But if you are in Australia or in UK or in America or in Canada, if you want to see a cardiologist, maybe you have to wait for 3 months, sometimes 6 months, sometimes 1 year. Because cardiologists are not so common there. And seeing a cardiologist is not so easy. So their approach is preventing the disease rather than treating the disease. We are mainly concerned about treating the disease. Prevention part is very weak in our area, but in Western countries they mainly focus on preventing the disease. Treatment is actually very poorly developed. So if there is some kind of disease, why our relatives living in different parts of the world coming to Kerala and getting the treatment here? Because they realize that treating a disease is very expensive and very difficult and take a lot of time in most of the Western countries. Because they focus on prevention, we focus on treatment. So that is the difference between our approach and their approach. So preventing and recurring or implementation of educational program and recommending policies to the administrative people are all important, and there should be a group of people who are actively conducting research about new diseases. When new diseases are coming, a new virus or bacteria is coming, immediately we should be able to find out what kind of virus or what kind of bacteria is there. Finding out the source of an infection is the first step in prevention. So if you don't know, if you are unable to find out that this particular fever is actually caused by a type of virus, then we won't be able to treat it. We won't be able to prevent it. So that is a problem. So there should be a group of active people who are involved in conducting thorough research about new diseases. So any possibility of a spread of a new diseases can be immediately solved at the very beginning itself. In contrast to clinical professionals like doctors and nurses, who focus primarily on treating individual after that. So what is the responsibility of doctor? They take care of you when you are ill. So that job is the job of medical professional. But public health professional, what they are doing, they protect you from getting ill. So there is big difference. Doctors are treating you when you are ill, whereas public health professionals are protecting you from getting ill. So that is a big difference between the approach of a medical people and approach of a public health people. So public health also works to limit health disparities. A large part of public health is promoting equity, quality and access. So health disparity is an important problem. In Kerala, this is somewhat better. That is why Kerala is always better in preventing disease. Even though a lot of rare type of diseases are coming in Kerala, we have a good infrastructure, good spread of government hospital, private hospital. Even in most remote areas of the Kerala, you may be able to see some good hospital, but that is not the case in many other states of India. So that is why Kerala has a higher health management system. So here there is one important aspect: health disparity. Earlier I told you about the difference between rich people and poor people. Rich people, they have money, they know, and they have influence, they will always get the best. But poor people, since they don't have money, they don't have contacts, they will only suffer, and most of them may be dying. And death of poor people is also a concern for the state. If a lot of poor people are dying, that shows the weakness of our health system. When no people, whether they are rich or poor, are getting are dying either because of any disease, it shows our system is well managed. So that is where Kerala has a better health management system, and there are a lot of reasons. One is our educational level, then our social equality. We do not give any special importance to anyone, whether they are rich, highly educated, or they have a lot of political influence. All people in Kerala are somewhat equally treated. So that is a good aspect. So if you go up to other states of India, you may find it sometimes very difficult to adjust. People discriminate between people based on their religion, based on their social status, based on their income, based on their education level. Lot of inequality you may be finding. But in Kerala, there are inequalities, but the level of inequality that we observe in Kerala is far lower than the level of inequality that we see in other parts of India. That is a big difference. Then being a public health professional enables you to work around the world, address health problems of the community as a whole, influence policies that affect the health of the society. So in the use of a public health profession, their concern is always protection. So if you want to protect you from one type of viral disease, the method that you are going to take will be same for protecting many other type of viral or bacterial disease. For example, drinking boiling water. It will directly protect you from having many kind of diarrheal type of diseases. But it can also protect you from many other type of diseases also. So a simple act for protecting the health can protect you from many other type of diseases also. So that aspect is an important thing. So if you want to save you from one disease, you have to have measure for saving you from many other diseases. So what you are doing for protecting society from corona may be highly effective from protecting from many other type of diseases also. So that is the way the public health professionals are working. Public health involves application of many different disciplines. Earlier I have introduced you to different type of, for example, biology. Medical people are directly involved. Anthropology. Why anthropology people are involved? For example, in Kerala we have tribal people. We have people living in different hill areas are there. And their genes and their medical nature will be completely different from our. Many diseases which are creating problem for people like us may not be creating that much problem for us, for the tribal people. Many diseases which will not create problem for us may be creating too much problem for them because they are not exposed to such viruses or bacteria. So if there is a light exposure or a small level of exposure, that may even completely wipe out their population. So anthropological people are important. How many type of people, what about their genetic composition? All these are in public policy. Public policy is the role of collectors. then Panchayat President. All these people are taking the public. Their role is important. Mathematical people. I told you about the importance of data science. Data science is an emerging science which has a lot of, because it's just an applied area of mathematics. So it is that is mathematics plus computer. Mathematical application are utilized using computer technique. That is what we do. People do in data science. Engineering. For example, if there is a widespread viral infection in some tribal community of Kerala, and we see that there is a river, and only if we cross that river, we will be able to reach, medical people will be able to reach there. What the collectors will do, they will be calling some engineering people, maybe Navy or Army. They will have their own temporary bridges. They will immediately establish a bridging system, as we see in Wayanad. They have been establishing a bridge within 2 or 3 or 4 days. They complete an entire bridge. So that kind of people should be also there. So that is why now we have a group of people called disaster management. Because in disaster management, they have everything. They know how to handle a disaster. Otherwise, what will happen is that people will, when they go to protecting a people, they find that they don't have the required equipment. So what disaster management people do, they know what are the possibilities. They will keep these equipments in handy. So when there is a problem, they will immediately bring this equipment by either helicopter or some other means. So educational people, teachers will be there, and they will be teaching students, teaching the public. Sometimes by doing social mock plays will be there. Psychological people are there. Why psychological people are there? In the use of corona, you might have known sometimes what happened for young children, their both parents may be died. In the use of flood or other type of natural calamities, if there is a husband, wife, and 2 children, and all the 3 people in the family have died, only one baby or one small school going child is there, who is going to take care of them? The child will be severely affected in the absence. So psychological people, sociological people are involved. So that is why public health is a very larger responsibility. A lot of people needs to be involved. Computer science people, they are bringing the apps, they are bringing the software. Nowadays, when there is some kind of problem, immediately some kind of new apps will be there. Who are making? Computer people are making. Then sociology, I told you, sociological people are also doing. They go to home to visit and assess how many families are affected, how many families have the financial means to go smoothly. All these people will be involved. Then medicine, doctors will be there. Doctors will be going to will be conducting home visit, and they will be giving medicine. Then business and other people. Because if there is some kind of problem, for example, a natural calamity, as a result of natural calamity, a lot of diseases are happening. And what happened is that in the case of Wayanad, what happened? Their source of income has been completely wiped out. They were mainly practicing agriculture. And what happened after that landslide? Entire agriculture has been vanished, and they do not know what to do now. Their only source of income has been completely completely gone. So they need money. They don't have anything. So business people are involved. They have to establish some business so that people get money, people have income, people can live without begging before other people. So that is why protecting the health of the people is not just a responsibility of 1 or 2 people. It involves a lot of people from many other areas. Now from science people, non-science people, mathematical people, political people, all these, even police people are also involved. So only then we will be because some people, we know, most of the people, if they will be immediately obeying if there is some general rule by the public health department. But there are people who simply don't bother. They need some kind of enforcement. So the police people will be doing that. So public health means responsibility from many departments. Only if they are actively coordinated then this process of preventing the disease will happen smoothly. So here one more area is there. What do public health professionals do? They will be monitoring the health status of the community to identify potential problem. So as I told you in the beginning, public health is mainly concerned with preventing disease rather than treating disease. Treating disease is the job of the medical people. The job of a public health staff is preventing the disease, diagnose and investigate health problem and hazards in the community. What kind of diseases are, what kind of bacteria or viruses are there in the body of most of the people in Kerala or most of the people in Kottayam. They will do a preliminary study before that. So when there is some kind of problem, immediately they can activate their emergency system. So that is an important, that is we have to monitor. We always monitor. So there should be group of people who always do monitoring work. Then inform, educate and empower people about health issues, particularly underserved and those at risk. For example, people who are poor, they don't have enough, they may not have a lot of money, their education level will be also very low, then they may not have many people to take care of them. Then sometimes the people, nowadays what we see is that in many families in Kerala, young people may be away, either away from Kerala or they may be abroad. So only in many families, only old parents may be there. So when some kind of illness or diseases are there, these parents may be very tense. They don't know if the mobile system also gone, they will be thoroughly tense. They will have too much tension. They don't know how to respond, because most of the modern communication system may not be very user friendly for these old people. If you know people above the age of 80 and you give them mobile and tell them please call us, they are not going to call you, they are not going to send a voice message, or they are not going to do a video call. All these are very difficult, those people. So those people will be very much at risk. Then mobilize community partnership to identify and solve health problem. Sometimes what happens is that we know different type of communities are there. In Kerala, different types of religions are there. Sometimes it may be taking place in one area where there is a possibility of religious tension. So if the political people or the civil service people are not handling the situation in a very sensitive way, sometimes what happens is that some religious leaders will say that that community people, that Hindu people were given more preference, or the other people say that Muslim people were given more preference, or some other people say that Christian people were given. Then it creates too much problem. So this is a very sensitive, very area because health means everybody is bothered. When there is a chance of death, people are so much worried, and people will, if some people are maliciously, because of bad intention, they are spreading these kind of rumors, then it creates too much problem. That is why sometimes the government is banning mobile internet in many areas when there are some kind of communal tension in there. So that is also an important thing. Develop policies, plans that support individual and community health. That is also, we should have right policies. Then enforcing the laws and regulation. So that is also an aspect, because police people should be doing that. Then it's their responsibility. Then link people to needed personal health services and ensure provision of health care when otherwise unavailable. For example, when there is a lot of corona-like situation, the entire Kerala was affected. In city area, urban areas of Kerala, there are many good hospitals, and getting treatment may not be a big problem. But if you go to the rural areas, especially the hill areas like tribal areas of Kerala, there may not be sufficient number of medical people, there may not be any labs. Getting treatment there is very difficult. So what this public health department should have a mobile unit, so that which they can take to such area and collect blood sample, treat them, give them medicine. So such kind of setup should be there. ensure a competent public health and personal health care workforce. So that area is still somewhat underdeveloped. As I told you, though in many Western countries, developed countries, public health courses are are so common. In Kerala, only few universities, especially in only in few medical colleges, Master of Public Health are there. In most of the universities, we do not have any Master of Public Health. So this is an important area. So only those kind of people can immediately respond. They know what kind of problems will come if there is a disaster, if there is a flood, or if there is some other natural earthquake. So now, so that group of competent people should be always there. Evaluate the effectiveness, accessibility, and quality of the personnel and population-based health services. So they should have proper knowledge. They should have right equipment. They should be thoroughly trained to handle situation like that. Research new insight and innovative solution to health problem. Already we have discussed about that. So these are some of the things public health professionals can do to prevent a disease. So what is more important is that public health is concerned with protecting people from diseases, whereas the doctors, medical people are concerned with treating people once they are ill. So there is a difference between these two group of people and their approaches. So we stop here.